Hi, good evening. I'm Dr. Philip McMillan. Thank you for joining me. And I'm keeping you updated with relevant news because Gert is stepping back. He's making a significant shift. And whenever Gert does anything, I take note. And I'm going to be going through his latest PDF here. I've highlighted a few points. It's like SARS-CoV-2. I'm ready for a major change. So he's stepping back, and that usually indicates to me that he realizes that where we are can't be fixed. There's almost no point to saying anything more. And this is what I think is coming across. Now, a lot of people still don't understand what Gert had said initially. And I had the privilege of speaking with Gert in 2021 when he made that first statement about mass vaccination risks versus benefits in a pandemic. And his point was very simple, is that if you did it in the middle of a pandemic, you would put pressure on the virus, it would start to evolve, and it would make the pandemic worse. I don't know how somebody, when you listen to what he said in 2021, could not think that what he said was accurate. It really, to me, is blatantly obvious that what he said was accurate. I think the other thing that has caught people out is that he gave a timeline. End of June, things would kick off. And a lot of people said, this hasn't happened. Well, let me tell you, it is happening. You just don't know. And when you know, it's too late, because by that point, it will be all over the news. And there's no point in saying it at that point. But I am telling you, clinically, on the ground, it's already happening. And I'll show you why I said that. And I probably think I understand what it is that Gert was talking about. My perspective is that I am looking at clinical manifestations. I'm trying to understand, well, even when this prediction occurs with regards to the viral variants that are completely breaking through, how will it present clinically? And that's where I have a different perspective. And for those people, I've said this just recently, is I am looking at the storm, the spike triggered autoimmune response mechanism. And this is what I anticipate is going to happen. And what is catching people out is that they keep on perceiving that it will present as severe COVID-19. So, just to remind you, if you do want to join my first presentation on this, this is coming up on Thursday, the 18th of July. Register. The link is below. I think the free tickets have gone, but we'd still love to have your presence. This is a very important topic because it's preparing clinically what is about understanding this storm and how potentially we can do something about it. I think part of the problem is that realistically, without the scientific community completely being on board and researching and actively trying to find solutions, there's very little you can do because you won't have any treatment protocols. And even if you suspected a patient had a storm, what can you do? There's limited leeway at the moment. And so this is why it is so significant. One of the other points is that because I have been looking at this for so long, in the context of autoimmunity and being able to be frontline to seeing patients. This is the difference. So, different from a researcher who is looking at papers, I had the opportunity to not just study the science, but to observe it firsthand. And so I've been looking at these patterns since all the way in 2021, after vaccines had first been rolled out, and seeing unusual patterns, and then looking at how the virus interacts to cause symptoms, trying to find a prodromal period for patients when they come with unusual symptoms. And so I've been studying that for now about 3 years, looking at the presentation and trying to feel it out and trying to understand it, and critically to work out, well, what can we do? The truth is that if and when we see this occurring, there is not a lot we can do if we don't have a clear strategy for immune suppression. That's the big concern that I have, is the scientific community is walking into this blind and the outcomes, if we walk into it blind, are quite serious. So let me just quickly take you through a few of the things that Geert had been saying, which I've highlighted here. So he's saying, like SARS-CoV-2, he is ready for a major change. And so he's relocating to the German speaking part of Belgium. I suspect that's a quieter part of Belgium. And he's adjusting his social media presence. I'll come to that in a little bit. And he's been talking about over the last 4 years, he conveyed his message. And despite his best efforts, governments, public health leaders, and expert scientists continue to misunderstand the dynamic, complex, and interrelated consequences that have evolved from their shot in every arm approach. So, this is an important point. He has been saying largely the same thing since the beginning of the pandemic. And as I said, for me, it's blatantly obvious. Maybe because I had the opportunity to discuss with him on multiple occasions, and I get to speak with him before and after the presentations, I really get a chance to listen to what he's thinking about. Sometimes, because of language, it can be challenging to get it across. But I'm telling you that I haven't found any better analysis of what's happening than what comes from Gert. Now, the other thing that he was saying is that you can see it here. So, this means that in highly vaccinated COVID populations, the immune escape pandemic is on the brink of transitioning from its chronic phase, he describes that as long COVID, to its hyperacute phase, enhancement of severe disease, and therefore likely to escalate excess deaths. I definitely completely agree with that. And it's something that, as I said, is already happening. It's just that you don't know because the numbers are not really in, meaning it takes a while for the numbers to be collated. And this will appear more like a storm surge rather than a tsunami. And a tsunami sounds exciting, but it's a big wave that comes in front of you and crashes on top of you. That's how people anticipate it's going to happen. No, it's going to be more like a storm surge. And a storm surge is like standing on the beach and you see a wave crashing in the distance and it washes up further than you thought. But when the wave washes up to your feet, it doesn't stop. It just keeps on going further and further. And before you know it, you're knee deep, then you're waist deep, and it just keeps on going out. That's a storm surge. And it is extremely dangerous because people don't react to it until it's too late. So, this is how I anticipate we are looking at what is happening. And so, just to tell you why, this is the scientific part of what is going on. I've got here a paper that I've spoken about recently, the virological characteristics of SARS-CoV-2, KP3, LB1, and KP23 variants. These are the new variants that are coming up. So this was posted on the 9th of June, 2024. And I'm going to show you a diagram in this that kind of highlights why it is that Gert and myself are so worried, because this is not stopping. And for those people who think this is normal, this is not normal. This is not how it works every year. If you have a flu virus and it passes through the population, and then the next year you have a flu virus, this is following no patterns. And it is just getting worse and worse. So here is the reality of the situation now. So this is looking at the transmission capabilities of the different variants. And JN1, the grandfather of them, this is they put this as one, so meaning that you're comparing it to JN1. And you can see that the one before it, the BA 2.86 one, was less transmissible. But KP2, KP3, these are significantly more transmissible. And the one that looks as though it's the monster is LB1, very transmissible. And when you look at the different regions of the world, you can see here in Canada, it's rapidly rising. This is while JN1 is falling off. And you can see here as well, KP3 has risen and coming down, but LB1 is starting to rise in Canada, the United Kingdom, the USA, And what it means is that there is variant after variant after variant. This is not stopping. And this is exactly what Geert had predicted. He said there would be an escalation in terms of the variants, and this is very significant. What's even more concerning, and this is something that came out of our last presentation, and when I realized what he was saying, I realized how serious this was. And it's this bit here. He said the as transmission efficiency increases, as we can see with the other variants, more animal reservoirs are being generated due to the transmission of SARS-CoV-2 variants from humans to animals, a phenomenon known as reverse zoonosis. Now, what it is that Gert explained at our last presentation is that he believes that what we're seeing in the animal kingdom with regards to bird flu is because of the influence of these variants on the animals. They are getting infected, and what you have to remember, this virus is exceptional at suppressing interferon. And so, what you're then going to have is co infections with the animals. So, they will get not only the Omicron variant, but they will get a flu variant. So, then you will see flu moving through the animal population. And then, when you have a human transmissible flu, it will come into the human population, and the immune systems that have been absolutely hammered over the last few years will not be able to cope. That's where you have the interaction between this ongoing SARS CoV 2 pandemic or epidemic in highly vaccinated regions, linking in to what's happening in terms of the animal kingdom. And the point that he said at the time that I really struck me is that if this is putting the whole animal population at risk as well, nature has a way of just solving it. Because at the moment, the problem is in the human population. They can't control the virus, they're unable to deal with the infections. The immune system is too hyper focused on the original variant. And so, variant after variant after variant, they can't stop the infections. It keeps on going around. This is pretty serious. Now, he has a perspective here, and this is towards the end of his thing. Those who are healthy and unvaccinated will indeed not be affected. I have a proviso in this, in that I think that it's not so straightforward. I think that the healthy and unvaccinated are at lower risk, but I don't think that they are at no risk. And that's one of the problems because they can still get infected. And every time the virus breaks through the immune barrier in the upper airways and gets into the bloodstream, this is where it makes a predisposition for this storm, spike triggered autoimmune response mechanism. And as I said, this is not something, when I talk about these things, people may think it's a theory. It's not a theory. I've been seeing this and studying this for a long time. And I am just looking at how it comes together and what the presentations can be like. We are seeing the most unusual clinical presentations, things you would see once in your career. We are now seeing quite frequently combinations of diseases like we've not seen before. It's just really, really very strange. The only thing that makes sense is that this is within that autoimmune paradigm. So, this is the bit that I think is very complex. People are expecting this to be respiratory disease. Some of it will be. It will be a viral pneumonia with secondary bacterial infection. And we're seeing that all the time already. But what is going to happen when we have pure viral viremia, where the viruses are circulating in the bloodstream, how it presents in each individual patient is very complex. It's not straightforward. Just to mention, there is a link in the description, and this is for Gert's new site, Immune Biology Discussion Forum. So if you're going to keep up to date with him, you just register there. Please support him. He's devoted 4 years into this system. He does it's certainly beneficial for him to have some financial support. So please, if you can afford it, join his community. and he will keep you up to date as to what is happening. I'm sure I'll be able to get him on another interview, and we'll be able to discuss in a bit more detail what it is that he's looking for. But at this time, I think that Gert's move is very concerning. And even I'm concerned with the degree of circulation of virus at the moment. It literally is everywhere. And we're not testing. And people are not really getting sick with the virus. And so people are becoming blasé about it. But they don't get sick initially, but you see them 3 to 4 weeks later with unusual symptoms and unusual illnesses. And you have to search for the prodrome because they don't even remember they were sick. The amount of times when I'm quizzing patients and I say, tell me, did you have any symptoms of a viral infection in the past month? And they go, yeah, actually, I just felt like a cold, had a little bit of a cough, but then I was okay. Then 4 weeks later, they're presenting with some strange autoimmune, sometimes neurological pattern of disease that makes no sense. And this is how the disease, I think, is going to be presenting in the near future, that autoimmune mechanism. So please, if you want to hear my analysis of it, join me at on Thursday, the 18th of July. The link is in the description. I'll then break down what I think is happening now and how it's likely to present in the future. So, as Gert steps back, I think he's recognizing that there's little else that can be done. Somehow, this is going to be sorted. And whichever way we take it, just remember what it looks like at the moment. Even though you're not being told in the news, this is where we are. This image here shows us that 4 different variants are circulating at the moment in different parts of the world. This is not going to stop. In another month, there will be another variant. A month beyond that, another variant, and another variant. This is not stopping. The question when does it become so serious that it has to be addressed? And the timing is very difficult to predict. But thank you for joining me. And again, remember to join on that webinar, and we look forward to keeping you updated in the near future.